Have you ever believed that the more medical tests you take, the healthier you'll be? Well, after 25 years as a physician working with older adults, I've learned something that might surprise you. Sometimes it's the tests themselves that quietly shorten our lives. The modern healthcare system tells seniors that more testing means better care. But the scientific truth paints a very different picture. After the age of 70, certain routine screenings no longer protect your health. Instead, they can bring unnecessary anxiety, false diagnoses, and even dangerous surgeries that were never needed in the first place. According to research published in JAMA Internal Medicine, over 60% of Americans over 70 undergo at least one unnecessary medical test every year. Even more concerning, 1 in 5 ends up hospitalized because of complications from those procedures. Think about that. Tests meant to keep you safe can actually put you in harm's way. That's why in today's video, I want to reveal 5 common medical tests you have every right to question. These are the same tests I've seen harm more patients than they've helped. And more importantly, I'll share how to talk with your doctor, so you can make smart, confident decisions that truly protect your health, your independence, and your quality of life. Before we begin, let me ask you something. How old are you? And do you think this information might help you or someone you love? Share your thoughts in the comments below. We do our best to read and respond to each one. Thank you for visiting Senior Health Tips, Healthy Aging. Let's get started. After 70, your body doesn't play by the same rules anymore. Your metabolism slows down, your immune system becomes more fragile, and the body takes longer to heal. So the tests that once helped catch problems early can now sometimes do more harm than good. What used to be a simple checkup at 40 can turn into a chain of stressful follow-ups, unnecessary treatments, and even procedures that your body simply isn't built to handle anymore. Think of it this way. When you're 40, your body is like a sports car. Strong, quick to recover, ready to handle a few bumps in the road. But once you're past 70, it's more like a beautifully preserved classic car. You still run, but every part is precious. You don't just pop the hood and start taking things apart. One wrong turn of a wrench, and the whole engine might stall. That's exactly what happens when unnecessary tests lead to risky biopsies, medications, or surgeries that weren't needed in the first place. And that's why every test, every scan, every routine check deserves a second thought. Because for older adults, more doesn't always mean better. Sometimes doing less, but doing it wisely, is what truly keeps you safe. And this brings us to the first test on our list, one that has left hundreds of thousands of older men wishing they'd asked more questions before saying yes. Number 5, the PSA test for prostate cancer. Let's talk about a test that's caused more harm than most people realize. The PSA test. For years, men were told that checking their PSA levels was the smart, responsible thing to do. After all, who wouldn't want to catch cancer early, right? But here's the truth the medical world doesn't always make clear. According to the U.S. Preventive Services Task Force, men over 70 should not get routine PSA screenings. Why? Because for most older men, the risks far outweigh the benefits. See, the PSA test doesn't actually detect cancer. It detects a protein that can rise for many harmless reasons, like an enlarged prostate or an infection. Yet, once that number looks suspicious, the system kicks in. Doctors order more tests, biopsies, even surgeries. And that's where things can go terribly wrong. I'll never forget one of my patients. Let's call him Robert. He was 75, active, loved gardening, and still took his grandkids fishing every weekend. One year, his routine PSA test came back slightly high. His doctor panicked, ordered a biopsy, and before long, Robert was in surgery. But here's the heartbreaking part. When the pathology results came in, they found the cancer was so slow-growing, it would never have harmed him in his lifetime. Instead, The surgery left him with permanent incontinence and severe complications that changed his quality of life forever. He told me later, "Doc, I wish someone had told me it was okay to wait." So let me ask you something. If your doctor suggested a PSA test tomorrow, would you say yes right away? Would you still agree if you knew the statistics? Only about 2% of men over 75 die from prostate cancer, but more than 30% suffer complications after treatments triggered by false alarms, things like impotence, infections, and loss of bladder control. That's the hard truth about the PSA test. It's not that doctors want to cause harm. Most truly believe they're helping. But the test itself often starts a chain reaction that does more damage than the disease ever would. The takeaway here isn't to reject every test. It's to ask questions. Ask whether the result will truly change your care. Ask if it's something that could make your life better, or just make it harder. Because at this stage of life, living well matters more than chasing every possible what if. And this isn't just a men's issue. The next test on our list affects millions of women, and it's been quietly causing unnecessary pain, fear, and medical bills for years. Number 4. Colonoscopy. After 75. At some point, almost every senior hears it. It's time for your colonoscopy. For decades, it's been considered the gold standard for catching colon cancer early. But after the age of 75, the story changes. And not enough people are being told why. As we get older, the body becomes more sensitive to stress. What used to be a routine procedure in your 50s or 60s can become far riskier later in life. The bowel prep alone, all those strong laxatives and fluid restrictions, can throw off your electrolytes, cause dehydration, and leave you weak for days. Then there's anesthesia, which affects older brains very differently. It can trigger confusion, delirium, or even long-term memory issues that sometimes never fully go away. And during the procedure itself, the risk of complications rises sharply. A small tear in the colon, something that might heal easily in a younger person, can lead to a serious infection or even life-threatening bleeding in someone older. The American College of Physicians now recommends stopping routine colonoscopy screenings after 75, especially if your previous results were normal. Why? Because by that age, the likelihood of finding a new, fast-growing cancer is very low, while the odds of being harmed by the test are higher than ever. Let me share a story that's hard to forget. Margaret was 79, bright, independent, still driving, still baking cookies for her grandkids every Sunday. Her doctor insisted on one last colonoscopy, even though her previous one was clear. She went through the prep, the fasting, the anesthesia, and by that evening she was in the emergency room with internal bleeding. She survived, but she never felt the same again. Her strength never fully returned. And the final report? No cancer, nothing dangerous. It was a test she never truly needed. That's why I tell my patients, after 75, it's okay to say no. You've earned that right. There are safer ways to stay on top of your colon health. Simple at-home stool tests like FIT or Cologuard, which can detect early warning signs without the risks of surgery or sedation. The goal at this stage of life isn't to chase every possible test. It's to protect your comfort, your safety, and your peace of mind. Because the truth is, longevity means nothing if the quality of life disappears in the process. And if that surprised you, wait until you hear about the next test, one that's been putting millions of women through painful treatments for a disease they never actually had. Number 3. Mammograms after 75. For many women, the mammogram has always felt like a safety net, a way to catch breast cancer before it's too late. But after age 75, that same test can quietly shift from helpful to harmful. You see, what most people don't realize is that not every cancer found on a mammogram is dangerous. Some are what doctors call slow-growing or non-aggressive cancers. the kind that might never cause pain, never spread, and never shorten your life. Yet the moment they appear on a scan, everything changes. The word cancer triggers fear. Then come the biopsies, the surgeries, the radiation, the medication, all for something that might never have become a real problem. That's what experts call overdiagnosis, detecting diseases that don't need to be treated, but are treated anyway. A major study published in JAMA Internal Medicine found that continuing mammograms past 75 didn't actually improve survival rates. In fact, it increased the number of complications, false positives, unnecessary surgeries, and emotional stress that can take a real toll on quality of life. I once spoke with a woman named Linda, 78 years old. Her mammogram showed a tiny spot, smaller than a grain of rice. The doctor said, "Let's be safe and remove it." She went through surgery, radiation, months of medication, and later learned that her tumor was so slow growing, it likely would have taken 15 to 20 years to cause any symptoms, far longer than she'd ever need to worry about it. She told me softly, "I wish someone had just told me to wait." So let me ask you something. If a tumor takes 15 years to cause harm, would you really want to spend 10 of those years treating it? Would you trade your comfort, your energy, and your peace of mind just to fight something that might never have hurt you in the first place? That's why, at this stage of life, every medical decision deserves a new kind of question. Not just, will this test find something? But will finding it actually help me live better? When you talk to your doctor, ask about your expected benefit and how it compares to your quality of life. Those two phrases can completely change the direction of your care, and sometimes protect you from a road of unnecessary pain. Because aging gracefully isn't about doing more. It's about doing what truly matters. And speaking of unnecessary pain, even if you're perfectly healthy, there's another kind of routine check that's quietly putting millions of older adults at risk every single day. Number 2. Overly tight blood sugar control. When it comes to diabetes, we've all been told the same thing for decades. Keep your blood sugar as low as possible. But once you reach your 70s or 80s, that advice can actually become dangerous. Here's the truth most doctors don't say out loud. For older adults, low blood sugar can be far more dangerous than slightly high blood sugar. That sudden drop, what we call hypoglycemia, can cause confusion, dizziness, fainting, even falls and hospitalizations. And I've seen it happen more times than I can count. I remember one of my patients, Robert, an 80-year-old man who prided himself on discipline. He checked his glucose 4 times a day, never missed a dose, and kept his HbA1c at 6.5. Textbook, perfect. But one morning, his wife found him unconscious on the kitchen floor. His blood sugar had dropped to 45. He survived, but afterward he told me something I'll never forget. I thought I was doing everything right. Turns out I was pushing too hard. That's why the American Diabetes Association now recommends a more flexible target for older adults. An HbA1c between 7.5 and 8.5, depending on your health and lifestyle. In other words, your body at 80 doesn't need the same level of control it did at 40. It needs balance, not perfection. Think of it like your home thermostat. If you try to keep the temperature exactly at 70 degrees, you'll drive yourself crazy. The air conditioner turns on, then off, then back on again, wasting energy and wearing out the system. Your body works the same way. It needs a safe, comfortable range, not a single perfect number. For older adults, a gentle fluctuation in blood sugar isn't failure. It's wisdom. It's your body saying, I need a little more room to breathe. Because stability doesn't come from chasing perfect numbers. It comes from avoiding the extremes that do the real damage. So if you or someone you love is taking insulin or glucose-lowering medications, talk with your doctor about whether your targets are too tight. Ask them, What's the safest range for me, given my age and health? And more importantly, what are the risks if we aim too low? You may find that by relaxing your targets just a little, you gain back a lot. More energy, fewer dizzy spells, and a lot less anxiety every time you test your sugar. Remember, living well with diabetes after 70 isn't about perfect control. It's about smart control. One that keeps you steady, alert, and independent. And speaking of independence, there's one final test that's become almost a ritual in modern medicine. The most common, the most overused, and the one that's quietly causing the most fear, expense, and unnecessary harm. Number 1. Routine CT and PET scans. Just to check for cancer. There's a growing trend in modern medicine, ordering full-body CT or PET scans, just to make sure everything's okay. It sounds like a good idea, doesn't it? Find cancer early, fix it before it spreads, live longer. But here's the uncomfortable truth. These scans often don't extend life, don't reduce disease, and in many cases, they cause more harm than good. CT and PET scans use radiation, and not just a little. A single full-body scan can expose you to hundreds of times more radiation than a simple chest X-ray. Over time, that exposure itself can raise your risk of cancer. But that's not even the biggest problem. The real danger comes from what doctors call incidental findings. That's when a scan finds something unexpected. A tiny shadow on your lung, a small spot on your liver, or a lump somewhere you've never felt pain. Most of these findings are harmless. But once they're discovered, the medical machine starts moving. You get sent for more scans, then a biopsy, then maybe even surgery. All for something that never would have hurt you in the first place. I remember an 82-year-old patient of mine. We'll call him George. He was active, sharp, still played golf twice a week. His son convinced him to do a preventive PET scan. It showed a small nodule in his lung, described as possibly suspicious. Within weeks, George was scheduled for surgery. They removed part of his lung, and the pathology report later revealed it wasn't cancer at all. But the damage was done. He struggled with shortness of breath for the rest of his life, and he told me once, quietly, "If I had known it wasn't necessary, I would have skipped the whole thing." And George's story isn't rare. According to research published in JAMA Internal Medicine, 23% of older adults who undergo follow-up procedures after a CT or PET scan experience complications, infections, bleeding, or hospitalizations, with zero improvement in survival. So I want to ask you something. If a test doesn't make you live longer, doesn't make you feel better, and instead sends you down a road of anxiety, hospital stays, and painful procedures, is it really worth it? After 70, the smartest health choices aren't always about doing more. Sometimes, they're about knowing when to stop. Your body has earned its peace, and protecting that peace means questioning any test that promises reassurance, but delivers only fear and risk. Because real health isn't found in another scan. It's found in understanding what truly matters: quality of life, comfort, and the freedom to enjoy your days without unnecessary worry. How to talk to your doctor and protect yourself. For many of us, it's hard to question the doctor. We grew up in a time when the doctor's word was final. You nodded, said thank you, and followed orders. But medicine today isn't what it was 50 years ago. It's more complex, more rushed, and sometimes more driven by protocol than by people. That's why, at this stage in life, you have to become your own best advocate. And it starts with knowing how to ask the right questions. There are 3 golden questions every patient, especially older adults, should know by heart. The first one: will this test or result actually change my treatment? You'd be surprised how often the answer is no. Doctors sometimes order tests just to be thorough, or because it's routine, or to protect themselves legally. But if a test won't lead to a new treatment or change your outcome, it might only add worry, cost, and confusion. The second question, what happens if I don't do it? That's a powerful one. Because in medicine, doing nothing is sometimes the safest choice. If skipping a test or procedure won't increase your risk in a meaningful way, then maybe you don't need it at all. Ask your doctor to be specific. Not, something bad could happen, but what exactly could happen, and how likely it really is. And the third golden question, is there a safer, simpler alternative? Maybe there's a test that uses less radiation. Maybe a short trial of lifestyle changes before jumping into medication. Or maybe just watching and waiting for a few months is enough. You'd be amazed how often that quiet, cautious approach prevents unnecessary harm. Now, let's talk about the hardest part. The fear. The fear of missing something. The little voice that says, "What if there is something wrong and I ignore it?" That fear drives so many unnecessary scans, pills, and procedures. But here's what's often forgotten. More testing doesn't always mean more safety. Sometimes it only means more anxiety. Real peace of mind doesn't come from chasing every possible illness. It comes from understanding your risks, asking the right questions, and making informed choices. And remember, doctors are human too. Most truly want what's best for you, but they also work under pressure. Tight schedules, endless paperwork, hospital rules. When you ask clear, thoughtful questions, you're not being difficult. You're helping them help you. So the next time you're sitting in that exam room, take a deep breath. Don't rush. Don't just nod along. Look your doctor in the eye and ask those 3 questions. You'll be amazed at how differently the conversation feels. Calmer, clearer, more respectful. Because good healthcare isn't about blind trust. It's about partnership, where your voice matters just as much as your doctor's. And that, my friend, is how you truly protect yourself. You know, the best way to avoid unnecessary tests isn't some secret treatment or high-tech scan. It's the quiet, steady habits that keep your body balanced. Sleep, real, deep, restful sleep, is where your body repairs itself. Yet so many of us trade it for late-night TV or worry that won't change a thing. Then there's nutrition. You don't need fancy diets or miracle powders. Just real food, vegetables, lean proteins, whole grains, and smaller portions than you think you need. And movement. It doesn't have to mean running marathons. A 20-minute walk after dinner, light stretching in the morning, even gardening. That's enough to keep blood flowing and joints happy. One of my patients, an 82-year-old gentleman, once took 4 daily medications for blood pressure and sugar. After 6 months of improving his sleep, diet, and daily walks, his doctor safely removed 3 of them. No new pills, no new tests, just consistency. And maybe most important, stress. Your body listens to your mind. Deep breathing, quiet prayer, time in nature, even laughter with friends. Those things lower blood pressure more effectively than many prescriptions. Because the biggest secret to staying healthy isn't hidden in a test result. It's written in how you live each day. After 70, the goal of medicine shifts. It's no longer about finding every little problem hiding in your body. It's about living well, staying independent, and avoiding unnecessary interventions that steal your comfort or peace of mind. You've already done the hard work. Raising families, building lives, surviving decades of challenges. Now, your health journey should be about quality, not quantity. More tests don't always mean more life. Sometimes they just mean more worry. So remember this. You don't have to say yes to every test that's offered. Sometimes saying no is the smartest and kindest way to love yourself. It's giving your body and your mind permission to rest, to trust, to simply be. And if what you heard today made sense to you, share it. Send it to your parents, your friends, or that neighbor who's always anxious about their next doctor's visit. Because one honest conversation, shared at the right moment, could spare someone you care about from fear, pain, or an unnecessary procedure. That's how we take care of each other. Quietly, wisely, with heart.